So Ali, on this video, we're going to be talking about the home health aide and how that home health aide is really the advocate for the patient. And what does that mean? What does that entail? What's the responsibilities there?
Well, essentially it is being the eyes, ears, and mouth sometimes for, and in the hands and the feet, really, of someone who needs it.
Whatever they need, it sounds like pretty much, yeah.
Pretty much it. Our reach is limited with certain things that we can do. People have to want to have a desire. They have to have control over their own lives. We can't suggest too many things, out of the pocket. They're not our parents. Yeah. You may see things and you may think, you don't need to be doing that, but
you have to respect their
privacy,
their
right to their right to fail, and their right to succeed. And if they want you a part as a responsible party, then you have the ability to be able to lend your opinion, and your professional outlook on things. As like I said earlier, our aides are part of the medical profession. Though we may be on a lower rung, it's an important rung on that ladder of healthcare. And so where we are is our aides are in the home, watching and seeing everything that's going on. And I tell my aides all the time, pay attention. The nurses and the doctors and the other family members, they can't be here. You get an opportunity as an aide to be able to watch, the client or patient deal with life on a daily basis. And so when there's changes and things like that come, you may see it before they are even willing or able to even, describe it or talk about it, or, and you can ask the right questions. You're not just there just to clean and go. You know what I mean? You're not just there just to, keep somebody company. You know what I mean? You're not just there just to make the dollar. The job is really important. You know what I mean? And so when you find that there may be things that's going on, sometimes it may be things that's outside of the scope of healthcare. It may be abuses that may be going on in the family. It may be abuses that's going on within a person, mental changes that may happen. You know what I mean? Other services that may need to be put in place. And it's not for us to go and create the avenues for these to happen. We're not superheroes. Being overzealous will get you burned out and make you very, very unpopular. At the end of the day,
being overzealous meaning speaking up too much or telling people this is how you should do this. You're doing this wrong.
Yeah, you got to be careful. Because you never really understand the dynamics of what's really going on. But if some things are straightforward, and we tell people, and it's a hard thing to not be so close, but you can't be too close, or you lose your usefulness. That's a hard thing to do, because you're talking about human beings, and we all want the easy way sometimes. And so getting chummy and things like that, and we allow things to happen that shouldn't. Well, one too many cookies that you shouldn't have when you got diabetes. You know what I mean?
Yeah.
Well, hey, I can't make you not eat it, but I can tell you that if you do that, this is what's going to happen. So education comes into play. You know what I mean? Just saying, enough for nothing. I want you to have that cookie just as much as you want it, but your diabetes might not want that to happen.
Well said. You've got experience doing this, don't you, Ali? Okay.
And that's important. It's definitely a mission and a responsibility. To know that you have a place there. As long as people are there and doing what needs to be done, following their care plan. You have a job to do, and you're there longer to make sure that this person is there in as much health as they could possibly muster up on their own, But we're only assistive devices, so to speak. You know what I mean? I can't be your leg for you, but I can be the crutch you need when you need to be able to get there and do, I can be the mouthpiece for you if you can't speak, I can be the eyes if you can't see. I can let you know how things go, and I can give you a professional opinion and some of my personal insight. We all have been there. I'm prideful and hard-headed. I had a mother that was the same way, and a grandfather. who is big as life, but it's not for us to really get in the way, but it's for us to speak up when they can't speak up sometimes, or to move when they can't move effectively like they would want to.
Well, you said it's what you do is like the bottom rung, but it's a really, I don't know, so it depends which way the ladder is. You know what I mean? Because it's pretty darn important. This sounds like something that you're interested in learning more about. First of all, you can learn more by watching some more videos that I've done here with Ollie at the website there at norwillhcs.com. Check it out because you can learn a lot about this field, what it's like to be in it. Ollie's been in here a long time. You've been doing this a long time, very good. And you can really learn and glean a lot of information. So again, please check it out, norwillhcs.com.